Okay. Good afternoon. I'm Patty Johnson, coordinator of the Southeastern Council of Foundations Engagement Initiative. This afternoon, we're delighted to present our program, Does Aging Matter? The Plough Foundation Tells Its Story. It's sponsored by the Plough Foundation and presented by Kate Midgley, Program Associate, and Barbara Jacobs, Program Director with the Plough Foundation. Katie, I'm going to turn the program over to you.
Well, this is Barbara Jacobs.
Or Jacobs. I'm going to turn it over to Barbara.
Okay, that's fine. I'm the Program Director for the Plough Foundation, and I'm just going to go over what we're going to be talking about today and a little bit about the Plough Foundation, and then Katie will take over. The outline for our presentation is to start with a discussion about the foundation and why we chose aging, why this is an important issue, and then Katie will talk about her work in determining aging issues in Memphis, including an internal and external scan, a survey of the elderly, and then what we've done about defining our role in this area and some lessons learned. So the Plough Foundation was started in 1960 by Mr. Plough, who was the founder of Plough Incorporated, which is a healthcare products company. And some of you may know about some of his early products, which were Maybelline, Coppertone, Skulls, and St. Joseph Aspirin, and the company is now a part of Merck. Memphis and Shelby County is a metropolitan area of about 1.3 million people, and the city of Memphis is 672,000 people, and that's really the area that we're interested in because we only fund in Memphis or our surrounding county. The Plough Foundation does fund in all areas, including arts and culture, health, education, social services, the environment, and civic organizations. And basically, we have a very easy process where someone just sends us a letter of a couple of pages. If we're interested in their concept, then we ask for an application, then we have an interview, and then it goes to our board. As far as the issue of aging goes, we were noticing that we were getting an increasing number of requests that related to seniors, everything from the construction of Alzheimer's daycare services buildings to additional vans for projects such as Meals on Wheels, to technology needs of nursing homes. And so we decided we really wanted to take a look at the population in our metropolitan area related to seniors. And, of course, there's so much literature in the last couple of years about the growing wave of baby boomers, and so this has become an important issue not just in Memphis but across the country. Also, several people on the staff had experiences either serving on nursing home boards or other elderly organizations, and we're learning more and more about the needs of the elderly in our community. We have a very small staff. We have 4 people, and we had decided in order to do this project that we needed to hire a new person, and many of you have met Katie Midgley, who is our program associate, and she was hired to really manage this project for us. And I'm going to turn this over to her now.
Well, hello to everyone out there on the telephone and on the web. Thanks so much for joining us today. We're really excited about sharing our story with y'all and hope that it will be useful to you. I think it's important to understand a tiny bit about my background. I was formerly in the early childhood world, specifically infants and toddlers and healthy pregnancies. So when I came to the Plough Foundation and found out I was going to be looking at aging, it almost seemed a little bit overwhelming. But I put this slide up on your screen because I think it's important. I say these lines often, so much so that I think the staff here gets a little bit tired of it. But I think when you're looking at any issue in the community setting, in the philanthropic world, it's always important to step back and ask yourself these questions. What's the issue? Why does it matter? And how can we best make a difference? So I'm going to walk you through sort of how myself and the leadership grasped or put our arms around that with aging in the next few slides. So I'm an analytical person at heart. And so one of the first things I did when I started was I said, okay, I've got to sort of figure out the numbers and see the snapshot of what my community looks like. Anybody, whether it's a new program associate, an intern, or even a seasoned staff member, can sort of use these freely available public record websites to get a sense of what you're looking at. I gathered data from census reports, State of Tennessee briefing papers, American Fact Finder, and others. And I really think, you'll see in the next couple of slides, that the data that we found confirms what our leadership was already suspected. Yes, Memphis and Shelby County, like other communities across the country and the nation is experiencing a demographic shift. And we already have more older people, but we're going to have more and more as the years go by. So I'm going to go through the next few slides to give you examples of some charts that I shared with my board that help sort of set the stage for the next part of our process. So we're looking at the 2010 census versus the 2000 census. I did this in 50 plus. And you can sort of see where we were in 2000 as to where we were in 2010. The numbers at the top show that, yes, we've seen an increase of 60,000 folks, 50 plus, in Shelby County, which is our funding area. I'm privileged because I was able to spend, a good month or so gathering research, reading recent reports, and that sort of thing. And I learned a lot about trends in older adults that are happening across the country. So, again, I wanted to see what Shelby County looks like. Well, older women, sorry guys, we just live longer than y'all. So you can see this here in this chart. My red bars are my females, and you can even look at the 85 plus age demographic to see these wide discrepancies. So I kind of wanted to set that stage as well, as when we start looking at initiatives, we need to keep these sort of things in mind. The Plow Foundation, we don't just focus on low-income people in our community, but we do know, as everybody knows, that a lot of times people who live below the poverty line are going to need more support. And this is sort of what I like to say is the Memphis story, as it might be in several of your communities. Not surprisingly, our urban core has more impoverished individuals as compared to suburban Shelby County. And American Fact Finder made that very easy for me to put that in a visual to share with the leadership here at the foundation. So this slide, I think, is important because after I shared with the leadership, okay, I've gone through the census reports, and yes, this is a case we should be looking at. I had to figure out sort of how to evaluate the feasibility of a funding approach. Luckily, Grantmakers in Aging, which if you're not already familiar with that group, you should become familiar if you're interested in this. They had a toolkit that I used and sort of followed their process loosely to sort of think about how to make this a meaningful initiative. We're going to talk about all of these steps in the next few slides, but this will sort of give you an idea. The internal scan, and then the real meat of the project is that external scan, which some of you on the phone right now were a part of. So I'm glad you could join us so I could talk about my experiences as a program associate. Okay, the internal scan. I will admit, as someone new to philanthropy, this was one of the hardest things to sort of wrap my hands around. I'm big on examples, and you cannot Google, I will promise you I tried, internal scan for a foundation and find an example of this because it's private information, right? But I would be happy to talk to anybody on the phone, sort of how I walk through this. I'll give you my contact information at the end because I do think, even though it was like pulling teeth for me, it ended up being an important part of this process. So as a new staff member, I also wanted to get sort of a feel of the flavor of my new foundation. So what I did was I worked with the leadership to pull some information from GIFT, which is the management software that we use to keep up with our funding initiatives. Others of y'all might use different programs. But what we pulled was data as listed here. I did a review of the previously funded programs classified in GIFts as benefiting the elderly specifically. I did a review of the declinations related to aging as well from 1989, so somewhat recent, because I did want to get a picture of who is in the aging world that had approached us, and for whatever reason we didn't fund, but sort of I just thought that would give me a trend line so I could see if those were increasing. And then I just wanted to generally see from 2006 to 2011, what all did we fund, what did that look like, and a sort of personal and also for this project to get a sense of how this works. I put this slide up there because I wanted anybody who's new to philanthropy or is bringing in a new staff member to sort of think about the different questions I was asking myself during the internal scan process. What are our giving trends? Do we give to children or minority groups more? Are we more likely to do capital funding or pilot or operational funding? Do we tend to go more towards large institutions or smaller groups? As Barbara stated earlier, the Plough Foundation is we're not limited in our giving except geographically. So there was a lot of data sort of looking at to look at this. But one of the interesting things I found that I did want to share, in addition to what she mentioned, like we'd fund some Alzheimer's Day services and others, was that there were a lot of grants that in our gift system were not classified necessarily as benefiting older adults, but that we had a lot of grants that indirectly benefited this by the very nature of what they do. We had given to veteran services, and so we know a substantial part of their population is older. A lot of larger hospital organizations here in Shelby County, including hospice services, and by nature of what they do, we know that some of those folks are going to be older. So that helped me sort of get a sense of where the Plough Foundation was until I added on to their staff of 4, so I could start thinking through that. All right, the external scan. As I mentioned, this was the real meat and potatoes, and me being an extrovert, this was one of my most favorite parts of this project. Again, what is the issue? Why does it matter? How can we best make a difference? This is in the what is the issue, why does it matter part. I'm of the mindset we don't need to reinvent anything. There's so much smart work being done across the country. So one part of my external scan, and I hope some of the folks from these foundations are listening in, because I was researching you guys, this redhead in Memphis, Tennessee. I said, I've got to put together a list of major foundations that have been working in this older adult world first. So actually I went to a couple of websites, Grantmakers in Aging and others, and put together, a chart with their names, their assets, how long, the history, how long they've been in existence, sort of constantly reading, constantly gathering to see sort of what is already out there. And this is reminding me that I need to pull that again to look at it. Sometimes we file things away and forget, but doing this webinar really helped me remember all the steps that we take. And again, if anybody wanted to call me, I would be happy to talk to you about how I did this. Quickly, here's the list of, if you're a football fan, the Big 12 that I came up with as sort of my initial folks to start looking at and thinking about potential contacts as I work through this process. All right. Well, as we said, we fund in Memphis and Shelby County. So it was important for me and Barbara to visit folks in our community to find out what they think. Not just nonprofits who are a wonderful, wonderful resource who work directly with participants, but we interviewed government officials, the faith community, researchers at our local academic institutions, we strategically, we were lucky because the Plow Foundation does have so many valuable relationships. We've been here for quite some time that we were able to get in and share a cup of coffee with so many people and ask them how they see older adults as assets, what their major challenges are, what do they see as major challenges moving forward. And this was sort of the qualitative research part of my work, and so I took, Barbara and I both took very meticulous notes and came back and sort of shared with each other to cross-check and make sure we heard the same thing. So we ended up interviewing over 70 people in the community in that external scan process. This chart here, I know a lot of you may not be familiar with exactly, the examples that we have here, but you can see AARP, our other foundations, health department, major health care. You can just kind of give you a sense of who we were talking to. One other thing we did, and I think some of the folks that participated in these are on the call as well. I was realizing a need to get people to play a convener role and get people in the room together. So one of our board members suggested, well, why don't you hold a couple of roundtable breakfasts or lunches and bring people together and sort of start talking so people can feed off each other. So we ended up having some breakfast at the Plow Foundation and did a SWOT analysis, which is sometimes overdone, but I think it worked in this situation because everybody was able to talk about the strengths, weaknesses, opportunities, and threats that they see within their area of expertise. And we took great notes on those and included those in our overall analysis of our external scan as well. All right, so after all of that note-taking and interviewing and over a period of 5 months, I sat down, one of those days where you lock yourself in your office and read through and highlighted all the different themes that kept coming up. Barbara did the same. And we both took notes and cross-checked, and then I sort of sat down and said, all right, here are the big 7. Here's what keeps coming up over and over again, in my opinion, and they're on the screen. Caregiver support and respite, transportation, elder maltreatment, basic needs, food, utilities, prescriptions, home repairs and modification, end-of-life care plans, and opportunities for community engagement. And I have to tell myself, because I presented that to my executive committee, and one of them went, well, goodness gracious, Katie, that's everything. I said, yeah, I know. It is a lot. But we know this is a cross-cutting issue. So that was a good meeting because we knew we were starting to identify big issues, but that we still had more work to do. I wanted to include a section on the ongoing external scan because I think this is important. It's not like this happened in, I did my national group of funders and put them away. While I was doing my interviews with local people, I wasn't doing interacting with other folks. I think what we're lucky in philanthropy is that we were able to take time and build relationships and attend some conferences that really helped connect us with folks. Grantmakers in Aging, as well as American Society on Aging conferences and webinars have been invaluable. I signed up when I first started for almost every research brief from AARP to Center for Retirement Research. I try to keep up with those as much as I can and read about new things. And then, of course, a little shout-out to engagement here. Participating in these webinars has been really, really helpful because I'm learning about what other people are doing, and that's what I'm hoping to sort of pay it forward today. So, again, tailing on myself, I'm nothing if I'm not transparent. We sort of came to this epiphany moment because when I first started and the leadership said aging, I thought to myself, well, okay, this will be easy. I'll look at nursing homes. And it's not that way at all. Seniors are going to age in place. They want to stay at home, and they will stay at home is the trend. So philanthropy and private and public folks have to start realizing that and address that. We're going to, it's 2013, we can look at technology. I think we're going to need to innovate. And we're also going to have to coordinate and get people talking to each other. So these are just some big takeaways that I was sort of starting to, really follow and understand more and more throughout this process. And so these are the questions. Again, I would present to my board, and I'd talk about the demographics, and I'd show a couple of videos. Again, people can call me or email me, and I can share. I've got a couple of really good ones that I think are great conversation starters. But, I said to my board, we've got to ask these questions with anything that we look at. Is it a good place to live and work for everyone across the lifespan? We're all aging. Are they ready is it ready to meet the needs of our older adults now? But what about when we're 105? And if not, if we answer no to those questions, what's the opportunity for Plow Foundation? We can't change Medicare. We can't change Medicaid. But surely there's something we can do as a philanthropic organization to help this become a supportive environment for people of all ages. So again, telling on myself, I had to go to my leadership and say, goodness, Shaw, I've got this big 7 topics, and I've talked to all these people, and I had them over for breakfast, and I've been to these conferences, but you know what I forgot to do? I forgot to ask any older adults what they think. And that was a good aha moment, right? We talked about, should we do focus groups? We talked about, should we do an online survey? But I was lucky enough to attend, I believe it was Grantmakers in Aging, where I heard about the Advantage Initiative, which it's done as a telephone survey. They also have a new online version, and they've done it in several communities across the country, as well as conducted a nationwide survey in 2004, I believe. We decided to do that here in Shelby County in the telephone survey. We did a total of 551 interviews, so it's a representative sample, and we set our older adult line at 65 plus. I think in other communities they've done it at different, 60 and above. And again, that last bullet, it measures the elder friendliness of our community. This is not just a needs assessment. This measures things that we can do something about, and also opportunities and how our older adults are assets. So that was very appealing to us. Just a quick, and you could go to their website to look at this, but it's divided into 4 domains, and the 4 domains are addresses basic needs, promotes social and civic engagement, optimizes physical and mental health and well-being, and maximizes independence. Again, this is interesting, and as I talk about how the whole process works in the survey, maybe you'll get understanding about why they are organized into these domains. But I like these. I like a good visual, and I like how really it is these 4 areas that do feed into what an elder-friendly community looks like. Okay, so the Advantage Project process. This is not, data is all well and good, but turning data into information and action is the really hard work. What we did was we invited folks here in Shelby County to look at the Advantage survey with us in our conference room before we implemented it. The folks that work day-to-day with people who understand different language barriers, who understand things we may need to add in, things we may need to take away. So we worked with that working group to finalize the survey. Then we worked with the Advantage consultants to implement the survey in our community. What you can see on that chart, I hope, is that we wanted to be able to look at a couple of different things. We wanted to be able to compare the city of Memphis to suburban Shelby County, because sometimes that can become a tale of 2 cities in terms of resources here in our community. We wanted to look at low income versus higher income. And then we also wanted to look at some racial differences. And so what was interesting about this report was that we were able to do that with that sample of 551, and we got really good response rates on this. We didn't put an incentive in. You can. But it turns out, I think a lot of older adults were never really asked these questions about what they think. And so the data is really interesting. I'm going to talk about that in the next section. Then the data is analyzed, and we worked with the consultants to look at the report. I'm going to talk about that little process too in a minute. And then step 4, which again we'll talk about, is we worked with a stakeholder working group to understand data and identify potential action steps. So again, this is not just a census report with where people live and and how many are in their household. That's great. But we wanted to do something different. So I thought this would be a good time to talk a little bit about our survey findings. Even if this isn't you're not interested in Memphis, this would give you an example of what you could possibly find out if you did this in your community or your state or your region. Okay, elders are an asset. They are connected to their communities, families, and neighbors. We found out that 92% of our folks had voted in the last local election, 89% had given to charity recently, and 60% have lived in their community for 50 years or longer. So given that they are such good assets in our community, how can we best reciprocate to the greatest generation is sort of the question we were trying to ask. Also, opportunities for action came up. Our low-income seniors, Memphis is a poor urban city, and we have some significant housing needs. Our low-income seniors, 35% of them struggle with heating in the winter. 43% with cooling in the summer. 45% need help with pest control. These are very real, tangible issues that came out of this survey. And then we do have a food insecurity issue here. I think Memphis was recently named one of the most food insecure communities in the country. And a lot of our older adults reported that they didn't know if food pantries or food banks exist, or they weren't aware if they did. Many of our urban adults need help with home safety and accessibility. Almost a quarter of our Memphis City residents said they need ramps, chair lifts, something to get in and out of their home. 60% of our low-income seniors across Shelby County said they need help with bathroom modifications, grab bars, accessible showers, that sort of thing. 19% of our low-income older adults said, sometimes or never, I'm not able to get where I need to go. So transportation is an issue. But that last bullet's important, I think, because 1 in 3 folks said they didn't know where to go for services. Memphis, we have a lot of nonprofits doing really great things, but sort of getting information into the hands of people that can make a difference seems to be a challenge. I wanted to elaborate on that in this screen. I've highlighted in black some of the things that came up as, a third of older adults or more didn't know about this service. Of course, some people may not know because they don't need to know about it, but to me this suggests a disconnect between services available and the messages or how people are receiving information about these services. And this was my group that I sort of talked about in our stakeholder meetings. This social and civic engagement a lot of times is the area least paid attention to by policymakers and funders, but it was really, really important to me. Almost half of our low-income older adults said, I would like to be more involved in recreation, and we know that that can also improve their health and other things. We asked some questions we added in, which I like about Advantage, about intergenerational interests. And 37% of our adults overall said, yeah, if something like that was offered, I'd be interested in working with kids on different nonprofits or different projects. And then there was a disconnect. While 31% of our older adults said they'd contacted a local official recently, a quarter to one-half said, government officials, I have very little influence on people like that, and they don't listen to people like me. So there's a disconnect between what the seniors are doing and what they believe their influence is. So a little bit about the stakeholder working group. Again, this is part of the process of the Advantage initiative that I like. We convened the group in June of 2012, and Phil Stafford and Mia Oberlink came down to Memphis. We looked at the data, identified issues, and brainstormed possible action steps. And then we had, what I like is everybody has a place at the table. It's not just action steps for philanthropy, but for the public sector, private sector, and faith community. This quickly, I wanted to show you the different people represented in the room. We were able to get our area transit authority, the city, the county. We wanted to make sure that everybody, I'm not an exclusive person, and I thought the more folks at the table, the better. So we got a lot of interesting perspectives in that room, again, serving as a convener. At least one potential action step was identified. Several creative potential action steps were identified. Again, how do we address basic needs, patients and providers, and increase participation? This is when those domains that I showed became important, because folks divided up into working groups based on those domains and brainstormed. And that was really helpful in terms of the room having different people, because everybody had expertise on different issues. So we've created a beautiful report summarizing the meetings and the process. We've printed 500, and we mailed 150 to community stakeholders. And then throughout the next year, we're going to strategically present the report to other key players. I do know it was recently mailed to both of our mayors and some other business leaders. So we are working on getting that information into the hands of people who can make a difference. So defining our role. So we've done this research. What next? What we announced when we reconvened the stakeholder group on January 9th was that PLOW is going to take on this, again, this convener role. So you see a trend occurring on this communications task force initiative. We've got to talk about how to get information both to seniors, how to get information to caregivers, how to get information to the general public about both our older adults as assets and our older adults as people who have very real needs, as well as groups need to be able to communicate between each other. And frankly, there's communication that needs to occur within groups. A lot of times we send our marketing person to a meeting, and then it's hard for them to get the information about the meeting to the executive director. So I wish I could say I know exactly how we're going to do this. We're going to really get some research and some help behind this, but I think this is going to be a very important role in getting people talking to each other and figuring out what we need to do. And a lot of how we do it and what we do is going to come from our group. We're also working to make sure that attention is paid to senior issues in the community. Memphis was recently invited to participate in the MetLife Foundation City Leaders Institute on Aging in Place. So we're going to be working with local officials who work on home repairs and accessibility issues on creating sort of a blueprint for that process and how we can all work together moving forward to ensure that older adults can get in and out of their homes. We've also recently given a grant to leverage funding to an entity here in Memphis who got a federal grant through building neighborhood capacity in 2 neighborhoods. And so we talked to him about how are we going to include older adults in that planning process? How are we going to make sure that their voice is heard in whatever you're doing? So Eric's been a great resource, and we're excited about working with him on 2 specific neighborhoods in the community. We're also, part of that progress that I showed you is we're looking at evidence-based programs and continuing to research different initiatives relative to those seven core indicators that I identified through my external scan that were also supported through our Advantage report. Caregiver support is a huge one. Here's an interesting program. I'm going to go through these pretty quickly just so you can get a sense of sort of what we're looking at. This is a teleconnection program. It was created in Texas and funded by the Harry and Jeanette Weinberg Foundation. And again, what it does is get information to caregivers through the telephone. It's kind of like the webinar we're doing now, but you don't have to have a computer. So Barbara Jacobs and myself visited them in Texas to try to figure out if that would be something we'd be interested in doing here. It fits in the communications paradigm, and it also addresses caregiver support.
Okay.
We're also looking for different caregiver programs that might fit more with the Memphis community. Is just a telephone going to be enough? This is a really interesting program from South Bend, Indiana, that was, again, funded by Harry and Jeanette Weinberg. But they also provide training sessions taught by a nurse that help caregivers know what they need to do, how to move somebody, how to get home modifications, and that sort of thing.
For our conference.
And they have a really great story that they tell about how they're helping people directly with what they do. And this is Mary and Leon's story. Mary was helping Leon bathe at a truck stop because they had home needs. They needed an accessible shower. So by working through Caregiver Connection, they were able to get the things that they need. So we're looking at Texas, we're looking at South Bend and trying to say, you know, would we need a combination of these? Would one of them work better than the other? And that just takes time, but we're constantly doing that sort of thing. Combating isolation. I encourage any funder listening to take advantage of conferences if you have time. I was at the American Society on Aging conference in Washington, D.C., and had a chance to visit the Harry and Jeanette Weinberg Intergenerational Center. And through my iPhone, took a bunch of pictures that you can see here on the screen now where you see younger and older adults interacting together. So I identified isolation as an issue in my external scan. My survey said people are interested in this sort of thing, and I was at a conference anyway, so I got to go visit this place. It all fits together, and I get to come back, have a relationship with these people, and share it with the executive committee for consideration, maybe not now, but maybe a few years from now. We've got to meet basic needs and improve health. Again, communication, right? Minnesota has a really interesting model on how to get older adults who are food insecure enrolled in SNAP, which is a Supplemental Nutrition Assistance Program. Well, folks who have low literacy may not quite understand. Reading through the application forms is complicated. There may be issues of, well, I'm not going to get that much, you know, because, and I'll have to go through all of this. So I like this visual because it shows something that they use. This is your income, just as it is. If you had your income and registered for SNAP, this is how much more food you could get. So we're just exploring different models from across the country under this communications paradigm. We're nearing the end now, but I wanted to talk about some lessons learned in these long 18 months that I've been looking at this aging issue. Don't reinvent the wheel. That was something I think I brought here, and I think the Plow Foundation was definitely supportive of. We always went to look to smart things that people are doing across the country. If it worked in Sarasota, Florida, it might work in Memphis. So building those relationships and talking to folks about what they're doing is invaluable. We did need to determine the role and vision of Plow Foundation in aging. The internal scan really helped me understand, but that's a lot of work that has to be done internally and in meetings
As a matter of fact,
to talk about what you really want to do. Leveraging personal connections is invaluable. I would not have known about Advantage Initiative if I had not met people at Grantmakers in Aging. The intergenerational lens, Maybe because I was in early childhood, but I really think this
And as soon as
asset-based
it's
approach, especially in a time of limited fiscal
finalize, I will may change that.
consider.
Adjust that.
Should grant making be needs focused or assets focused? I think we still are asking ourselves that question, but that's okay. I think that's important. I think we're doing some pilot programs where we'll be able to answer those. With Community Lift, it might be more asset, and then needs focused might be more on some others. And then the national trends. You know, if I hadn't talked to people and learned about what's going on, I might still be looking at nursing homes. Basically, what we're looking at is a new definition of aging, a new attitude, and a new interest. It's not the same as it was even 10 years ago. What I'm trying to share and what I think we're realizing in Memphis is that this aging boom is going to impact almost everything that's done, from housing, from volunteerism to caregiving in families and workforce development. Everybody has a role to play. This is something that we should celebrate for sure. I mean, we all want to be part of the groups that live a lot longer, but it's going to require planning and thinking about smart choices and working together in order to ensure that we do the best we can for folks as they live into their older age. And I always like to end with a quote, but I think this is a good one. Improving a community sometimes involves organizing people. And we've been taking that convener role thus far. But it's important because I think framing this issue will be the most important thing we do before we take the steps to determine how we're going to solve it. Well, and at that time, Patty, I guess I'll turn it over to you for questions.
Yes, we have about 8 to 10 minutes for questions. If anybody's got any, chime in, raise your hand on the screen. Let's see if I can see everybody here. But Katie, that was great. You went through a lot.
Thank you.
Deborah Jacobs, go ahead.
Katie, you have done a magnificent amount of work in 18 months. The way you've approached it, very, very impressive. It's almost a tutorial for any foundation who's considering getting into the older adult space, and the learning that you had about how this is connected in so many dimensions. Could you talk about how this has affected the PLOW other grant-making focus areas?
This is Barbara Jacobs.
Okay, great, Barbara.
I think that one of the ways is that we're looking at all of the grants that we get, or a lot of them, to see if there's an aging facet. That maybe whatever the group is planning, whatever kind of project, are they considering how seniors will be involved? For example, the program that Katie mentioned about the federal planning grant that's come for neighborhood planning, when we got involved in that, we made sure that the senior voice was going to be included. So I think it has helped us a lot to focus on seniors and to keep reminding people when they're doing a project, well, is it good for seniors too, or how are seniors involved?
Barbara, could you talk a little bit about how your board has, I know Katie talked about how it bubbled up, but have you had any ahas or surprises that everybody was taken aback by?
I don't think so. I mean, Katie's reported to our board. We meet quarterly, and every quarter they receive an update. And I don't think there's been any real surprises that have come up.
Okay. Thank you.
All right. If you have your phone on mute, don't forget to unmute it if you want to ask a question or make a comment. Unmute is *7. Well, Katie and Barbara, okay. Ashley Cash has a question.
Hi, this is Ashley from Community Lift. I had a question about, earlier in the presentation, Katie, you mentioned that women are outliving men by a lot, and I guess I don't know if this is the appropriate venue to talk about this, but what kind of what does that mean? Does that mean for programming purposes, organizations like mine should be thinking more in terms of what women's services may be more available, or should we be thinking more in terms of helping older men to live longer lives? What kind of implications does that have?
Man, that's a great question, Ashley. It's sort of a double-edged sword, right? You know, I think from an asset-based approach, and I'm thinking specifically about your organization. Older women, from the research I've read, are more likely to volunteer, to rock babies, to do all of those traditional things. Be more nurturing, and collaborate. I think a lot of times they're natural collaborators. So I think for Community Lift, it would be interesting with the work you're doing to sort of, just a suggestion, a leadership council of older adult women that could help advise on different neighborhood issues. I think we've all had personal experiences with the little old lady who lives in our neighborhood that checks on all of us and sort of serves as that neighborhood watch or something like that. I think from an asset-based approach, looking at older women would be interesting. From a needs-based approach, when we're looking at public health, I think getting men, and in our report it showed that men were less likely to get preventative health screenings, colonoscopies, that sort of thing. Okay. So maybe in that world it might be more appropriate to look at targeting men with outreach and that sort of thing. So I think it just depends.
Okay, great. Thank you.
Anything else?
May I weigh in here? I think that Ashley's question and the way that Katie responded is a real reminder to us is that there is no single answer. And Katie's quote about engaging others in the conversation and figuring out things, if this was easy, it'd be done, and it's just a great opportunity for continuing conversations and really approaching it from a what are the possibilities. So just an affirmation of the great work being done.
Well, thank you.
Thank you.
Okay, anything else before we close out? Well, first of all, thank you very, very much, Katie and Barbara, for this very informative program. I have a much better understanding of Advantage now than I did. In about a week, we will have this up on the web, on YouTube, and we'll send you an email and let you know. Please don't forget to fill out the webinar survey as you leave the ReadyTalk site. And unless someone wants to volunteer today, we will not be having a webinar in February. However, we are booked March through June, and we've got a couple of programs for late summer and fall. And I'm delighted to tell you about our March program. And I hope I don't butcher the name. The Follinger Foundation in Fort Wayne, Indiana, and the Community Foundation of Greater Fort Wayne recently announced that they provided financial support that allowed two agencies providing critical community services for the elderly to explore how they could better provide those services together. The result, the Aging and In-Home Services of Northeast Indiana and the Allen County Council on Aging merged. Cheryl Taylor, the CEO of the Follinger Foundation, will share the conditions that prompted the merger, the experience, and the journey. Of course, she'll take questions from webinar participants, and this program is being sponsored by the Patterson Foundation out of Florida. Does anybody have any general questions or comments before we close out?
Patty, this is Katie. I just wanted to reiterate that I believe my contact information is on the screen. I'm one of those folks that sometimes doesn't want to ask in front of a bunch of people. So I'd encourage anybody who is interested to either call or email me, and I'd be happy to talk to them directly.
Thank you. I know that will be appreciated. But thank you all so much for participating, and for Katie and Barbara for putting together this so informative and interesting program. Thank you.
Thank you.
Bye-bye.
Thank you. Please stand by.